present. Are you still good?
All good. Perfect, in
Yeah.
fact. Absolutely spot on, Jane. Thank you.
Right. For the moment, I'll stop sharing. Well,
That's
I'll
all
stop
right.
presenting, as it were. There we go. Do you want me to stop sharing too?
No, I don't see that. That's fine.
We're
So
okay.
I think it's absolutely fine.
Cool.
We're on our usual run of it's 2 minutes to, and there's not very many people on. But equally, I mean, sometimes there are quite a few people on. Sometimes there are not.
And
And
it's
very often the
recorded
ones
too.
where, well, exactly, that's what I was about to say. There are quite a lot of people who go to the recordings afterwards, which is fine.
But I'm great to see Ophelia because I kind of wanted to kind of send you the details of now we've launched, and when we know how it's going, whether or not it's something that you might want to
Yes.
talk to. So it's good.
Ophelia, how are your friends just across the way after after his wife had died? Are they okay?
Chris had, it was his birthday 2 days ago, and I called him.
Uh-huh.
He's going to come to Mexico to sell the house here in Mexico.
Oh,
He don't
okay.
want to.
That's sad for him.
Yes, he's coming in February. I call him every week.
Right.
Mhm.
No, that's a shame. It's a sad thing. Matea, hello. I probably need to start learning about other people's Christmas traditions. So, what does Christmas look like in Slovenia?
Actually, our family has an Hungarian.
Oh, okay. What's
My
that like then?
grandfather was Hungarian. We eat turkey on the evening on the 24th, and all the family has to be there. It's
Turkey.
the most important evening in the year for the whole
That's
family.
interesting that you do it on the 24th in the evening. I think quite a few people do. What about you, Javier? What do you do?
Yeah, we meet all together, the whole family, the big family. We have a big family. We
Javier
meet
had
about
many sisters and brothers, many.
we
10 or
we
how
meet
much?
we meet about 40 people that come. We have a lot of nephew. They living abroad in Sweden, Germany, France, Australia. They come all together and meet this time of the year. No, that's a
Fantastic.
great, very very big meeting this year. No? That's great. No, uh, eating is not so important. It's just meeting and share the time together all.
Yeah. No, that's really good.
And then we meet 24th and 25th, then both days.
Okay. So, Matteo, what do you think of turkey? The meat, I mean.
Sorry?
I was asking Matea what she thinks
Ah,
of turkey food.
Once a year is okay.
For me, that's what we will have because the rest of the family want it. But for me, it's once a year too many. Seriously
I agree.
overrated,
I
poor
agree. I
things.
agree.
Never mind. How are we doing numbers wise? Hi, Dave. I can see. Oh, and see you as well.
Hello, hello everyone.
Hi there.
Hello.
Right, let me go in the other direction. Okay, it's 2 minutes past, so I suspect that what's actually likely to happen is that either people will dribble in or this is all we've got, in which case, Jane, I apologise, but as we said earlier on,
It's recorded. It's
it's
a kind of
recorded.
a dip in at your leisure, isn't it, when
It
everything's
absolutely
recorded? So
is.
no
It is.
problem at all. Completely
Okay.
understand.
So I think at 2 minutes past we could quite reasonably start, if that's okay
In
with
which case,
you.
I will share my
Uh,
screen. Thank you for those who've
thank you.
joined live. I will share my screen. And
I will just start with an introduction. Though having said that, I think the people who are on with us need no introduction to who Jane Entwistle is.
Probably know me better than I do.
But for the advantage of people who are joining later on to listen to the recording, Jane has been a member of SEGH for longer than I have, and I've been a member since 2002 or 3, I think. Very much a stalwart member, very much one of our fellows. And in point of fact, if you've been keeping an eye on what's going on the website, then is the nominated individual for our next president, for which the results will come out imminently. In fact, was it today or is it a week today? I've lost track, but definitely imminently. Jane is Professor of Environmental and Geochemical Sciences at Northumbria University. And is going to take us through hidden in plain sight, toxic lead metal continuing to impact our communities. So for any of you who were at the conference in summer, then you will recognise that also it's an interest of mine too, because as I said to somebody else recently, we've got lots of new problems, but the old ones haven't gone away. So without further ado, Jane, please take over.
Thank you for the introduction, Gillian. And yes, let me pass over. So for many, it's a well-known legacy contaminant, but there's also a resurgence of interest for very good reason as well. So I'll set that out as I go through my talk. So let me share my slides. Right, hopefully the presentation is up and running. Do yell as we go through if anything turns up. So thank you for the introduction. So I'm going to have a brief look at why lead, because obviously SEGH will know an awful lot about lead, but I will set some information just out there for those who are maybe a bit newer to lead exposure. I'm going to focus the bulk of the talk on what's new, and then end with what we can do about it. So why lead? Well, lead is a persistent environmental contaminant. It can cause toxicity even at low blood lead concentrations. And there's no known safe lower threshold of exposure. So in terms of lead, it has potential to cause multi-system toxicity. You'll see the kind of paint pot example here from the WHO. It can damage the brain, the kidneys, the liver, the reproductive system. It can impact at all ages, but particularly young children who are most vulnerable. So their nervous systems are still developing, and they also have a propensity to absorb more of the lead that they take in than adults. And why it's of particular concern is because it can affect not only intellectual development and cause lowering of IQ, but then it can have broader impact in terms of underperforming at school, behavioural issues that then go on to have lifelong implications for that child. It can also affect adults and also affect pregnant women. So if we want our children to reach their full potential, then we need to remove lead from our everyday environment. Where do we find lead? Well, more or less anywhere we look, we will find lead. So in terms of a kind of a domestic setting, we have it in terms of our paint and paints in our homes. So that is largely, well, it is historic now. So lead paint had wide domestic use, not just in the UK, but more or less globally. It was gradually withdrawn from the 1960s, but we still have a lot of our housing stock will have some sort of lead paint associated with it, particularly where that housing stock is older than the 1970s. We'll also associate lead with historic use in water pipes. Again, from a UK perspective, lead was banned from water pipes in 1969, but the legacy of its use in pipes still continues because they haven't all been yet replaced or removed. But more broadly, we see it in spices, we see it in traditional medicines and some cosmetics like coal, and we also see it not only in lead shops, but in construction work where it's still used for those kind of joins in between roofs and where chimneys join roofs. So we see quite commonly the use of lead flashing because it's so malleable. But obviously one of the ones that we really associate it with is lead in fuel, in gasoline. Millions of tons of lead were added to gasoline worldwide, beginning back in the 1920s, 1922. And that still persists as a major source of pollution. But since the 1960s, lead began to be removed from automotive gasoline. The removal wasn't actually completed till 2021, when I read that Algeria last ran out of its supplies. But as we know, lead is a persistent contaminant in the environment. But we have seen really positive changes with this regulatory change, particularly around lead in fuel oil. If we look at reduction of lead across the population, this is a European image, then we can see blood lead concentrations on the y-axis, the date on the x-axis. So this particular graph shows from the early 1970s up to 2020. We can see this gradual lowering of population blood lead concentrations. But lead is a persistent contaminant. It still exists in our everyday environment, despite this lowering overall of blood lead concentration. And current estimates suggest around 1 in 3 children, which is a huge number, have blood lead concentrations at or above 5 microgram per deciliter. So that's the threshold at which many nations, not the US has now got a threshold of 3.5 micrograms per deciliter, but it's a threshold at which many nations recommend taking clinical or public health action. So we know lead exposure remains a global problem. For those eagle-eyed and particularly interested around a global burden of disease, then the latest report that was out last month still has lead exposure in the top 10. It's coming in at number 10. So this study was published, the update of this was published in the Lancet in early October. So we know lead continues to be a problem, particularly affecting not only our children, but also our adults. And there has been something of a resurgence of its concern across the UK. So I've just captured some of the kind of mainstream news media just from this year, looking at the kind of expose and awareness raising of lead. So BBC Wales did an investigation about historic legacy lead mines across much of Wales. We've seen it in many of our regular broadsheets like the Times and the Daily Mail. And there was an excellent series, if you haven't watched it, from Laura Hughes, it was a podcast highlighting everyday exposures to lead in our homes. And what all of this was highlighting is that the UK has no screening programme. So we don't routinely screen children between the ages of 1 to 5 and to help us identify those with elevated blood lead concentrations. And we have no current data estimating how many children in the UK are exposed to lead above 5 microgram per deciliter. So I know to many of my colleagues in the US, that's incredibly surprising. So what's new? So that's a very brief run through why lead. So what's new? What's new and what I want to tell you about is ECLIPSE. It's the Elevated Childhood Lead Interagency Prevalence Study. And we are looking at a protocol development and feasibility study. So our vision of ECLIPSE is establishing a transformative new approach for child blood lead monitoring. So we're going about protocol development, and I'm going to unpack this in a little bit more detail in my next few slides. So this is the kind of high level overview. So we're doing protocol development. So having a look at an approach to child blood lead screening, which we think is rapid, robust. We're hoping it's simple to use in a home biomonitoring as a home biomonitoring approach. We're looking at how best to cohort recruitment, how best to do standard operating procedure to feed back on the blood lead results we find. And it's very much a multidisciplinary team of people working on this across health, social and environmental sciences. So we've now at the point where we've developed the protocol and we've just started to deploy it. And we're deploying it across one UK city in the north of England called Leeds. Obviously then we will look at protocol refinement once we get the initial feedback. And moving through the study, it launched on the 17th of November. Because we have the involvement of the UK Health Security Agency, they are really behind this. So it raises the profile of the possibilities that we may unlock either a child screening program in the UK if this home sampling approach works, or a larger prevalence study. I'm often asked, why are you launching it in Leeds? And there's so one of the key reasons is why we're choosing Leeds. Leeds is just a typical post-industrial city in the north of England. It has many characteristics in common with many of our cities in the UK. But what Leeds does have is a high awareness of the potential for lead exposure and toxicity amongst its healthcare teams. And unfortunately, some of this stemmed from the death of the 2-year-old boy in Leeds back in 2015. And what we see in terms of the data that's collected on elevated blood lead level in children, I've summarised in this graph here. So what we have in the UK is we have something called the lead exposure in children surveillance system. And where we have elevated blood lead levels above 5 microgram per deciliter reported into this central system. And you can see here that since 2015, the green bar, which represents Leeds or the Yorkshire and the Humber area, has always reported more cases of elevated lead in children than anywhere else in England. This isn't because Leeds, we anticipate, has more of a lead issue than anywhere else in the country, but because of this heightened awareness. And also, there is a system in place that where the doctor or the clinician is recommending a blood test for anemia, there is also a pop-up that says, have you also thought of asking for a blood lead test too? So we know from Leeds that where you ask for more lead tests, you find more elevated blood lead concentrations in our children. And so this is part of the reason why we want to really investigate what is the real prevalence of exposure to elevated blood lead levels in the UK population, in the UK children's population. Before I move away from the lead exposure in children's surveillance system, I think it's really interesting, well, it is for me and hopefully for the SEGH community too, just to see what their findings are showing. So this is the kind of leak summary data. So I should say in 2023, only just over 200 cases of elevated lead were recorded in children. We know this is the tip of the iceberg. But from the data that's been collected since the surveillance system was put in place in 2021, 2023, these are the categories of where we've seen exposure. The vast majority of exposure has been associated with soil, then paint. But we also see elevated levels of lead, so exposure related to imported spices and food, traditional medicines and herbal remedies, imported utensils and ceramic pottery. It has also been associated in a small number of cases with where the parents' or guardian's occupation involved lead exposure. And we also still see lead in drinking water as part of that exposure profile. The majority of cases tend to be male children between the ages of 1 to 4. They tend to reside in the most deprived areas. So, of course, this is also leading into that kind of environmental justice growing body of mindset, where we do need to tackle environmental inequities as well. The mean, out of interest, the mean blood lead concentration in these detected cases was well over 5 at 8 microgram per deciliter. And the majority of cases exhibited peak behaviour and had learning difficulties. So that's kind of what we're finding in a UK in terms of where we're already reporting elevated blood lead levels. But what we don't know, because we don't have the data, is what are the actual numbers, estimates of children exposed to elevated or experiencing elevated blood lead levels in the UK. So if we have a look at a 2021 report, I think it was, from the UNICEF and Pure Earth, they estimate that in the UK, there is somewhere between, if you look at the confidence interval, somewhere between about 186,000 to just over 280,000 children with elevated blood lead concentrations. Now, our leak system in 2023 reported just over 200 cases. So clearly, if we don't know about them, we can't put early interventions in place. So again, part of the call for this activity to either have screening in place or to have a greater ability through a prevalence study to know the number of cases we're dealing with. We need it in the UK because we're only picking up the tip of the iceberg of elevated blood lead cases. A little bit more about the study and where we are in it. So it's now launched. So this is some of the information on the recruitment. For those kind of embarking on this kind of study, just a list here of some of the materials that I'd urge you to get together well in advance. Participation in invitation letters, information sheet, consent forms. We have an intake survey that's part of our eligibility screening. And we also ask for their GP or their doctor's contact details because it's part of our follow-up procedure. We get information on socioeconomic information, education levels, and ethnicity. If we go to where we're deploying this study in Leeds, there's something like 340 40,000 households in Leeds. We are sending out 150,000 letters. We've sent out the first 30,000 now. We anticipate that from those 150,000 letters, about 20% of those homes, because the data is collected from our census data, about 20% of those homes will have children of the eligible age to take part. So that's between 1 and 6 years old. So of this approximately 30,000 eligible families, if we are on the side of caution and assume we have about a 5% response rate, then we anticipate we'll have about 1,500 completed surveys, and we're planning to send 500 blood test kits. I'll tell you what they constitute in a moment, out to those homes. We'll also do quite a detailed lead exposure questionnaire alongside the blood sampling. So that's our recruitment. As well as developing the recruitment materials, we've also been working on the biomonitoring approach. So those who were in the summer at the SEGH conference will have heard a little bit about this. But what I'm going to do is hopefully share my video with you so you can have a sense of this approach. So what is novel about this approach is not using a finger prick test itself, but it's the fact that the finger prick test, the sampling card we're using, samples a fixed amount of 10 microliters of blood. So it's collecting a known volume of blood onto the filter paper that then gets dried and sent back to the laboratory. So that's the first part of the novel element of it, that it's a quantified finger prick blood sampling test. And the second bit is we've kind of ditched the nurse. So this is being done by the parent themselves in their own home. So we are looking at the feasibility of whether the parent or guardian is able to collect a blood spot sample from their own child. So there are a number of elements, obviously, we're exploring. Let me show the video so you get a much better sense of what the technique's doing rather than me talking about it. So let me put it onto the right screen. It's not a very long video. And if you can't hear the sound, the text would work anyway. hopefully the music will now stop, but we will see if whatever's on YouTube then carries on. I'll have to deal with it. But so hopefully you've got an insight as to what the technique is doing. Obviously, we will require. We're looking at how clean the finger will be, and we've also obviously hopefully got 2 spots to look at the variability in the blood sample from the one child. So let me carry on. Going to let me move on. Yes, it is. So I'm not going to go through this in any detail, but one of the other hurdles that we really have to have addressed is how you report the blood lead results to the family, because all of this is being done remotely. Okay, so it's all being done through the post, it's all being done online. So just to summarize, that we have different letters for the different categories. So we are anticipating some invalid test results for a variety of reasons. We are anticipating some children's blood lead concentrations are below our reporting threshold. We have chosen 0.2 micromole per litre. Those who aren't clinicians like myself, that's 4 microgram per decilitre as our reporting threshold. If it's below that, you simply get a lead safe leaflet to raise awareness of how to reduce exposure to lead in the everyday environment. Where it's elevated and above that, then they'll go into the kind of usual system in the UK, which is they will then get a venous sample taken through the GP or the clinician, and that will corroborate or not the finding from the capillary blood sample spot. And then it will go into the leak reporting system, the lead exposure in children reporting system that I mentioned at the beginning of the talk. We also have a pathway for where we see any extremely high blood lead levels. So that's up to or above 40 microgram per deciliter, because they need urgent treatment. And so there'll be a rapid response system involving paediatric A&E, but also confirming the result with the venous blood sample. So as part of doing this, there's been a lot of activity around community awareness raising. There has been some concerns along the way about making sure this isn't phishing emails that are going out or false information for people to hand over their personal details. So it's been really important that we do a lot of community awareness raising in the local area, and the NHS in the local area as well have sent out communications through their channels. And because obviously we're at SEGH, not only are we sampling blood, but we're also offering an opportunity for the families to send us house dust and garden soils and yard soils for laboratory analysis. And we've developed a lead safe booklet, which will be on our website for anyone who's interested. Hopefully I've given an overview now of why lead, what's new, what we're hoping to do with this home biomonitoring sampling approach. What can we all do? So some of you will be aware that we have an International Lead Poisoning Prevention Week led by the World Health Organization. This year's strapline was no safe level. Act now to end lead exposure. Goes without saying, that there is no safe level of lead. So they are pushing that we learn the risks from lead, we publicise them more broadly. They want people to join the action, because then we have a better chance of eliminating and minimising lead exposure. I'm also just sharing last year's lead exposure campaign, because they have the most amazing, succinct campaign titles. So last year was Bright Futures Begin Lead Free. So what I'm trying to get out across the SEGH community is that we can all do something in Lead Prevention Week. These are a couple of examples that came out during Lead Prevention Week in the UK. So British Coatings produced a new leaflet, updated their website with advice for avoiding lead exposure when decorating. So if you're dealing with old lead paint on your walls and windows. WaterSafe also highlighted that it's still, unfortunately, incredibly common for plumbers to use lead solder, and that we should be proactively asking what is being used to solder our pipes, as there are other alternatives out there. And the UK Health Security Agency also put out a publicity campaign and advertised that even eating one single flake of old lead paint can be incredibly harmful to a small child. So SEGH need to be represented. So certainly next October, I want us to be mobilising as a community to make sure we're also putting out some advertising in terms of raising awareness and getting involved in the International Lead Poisoning Prevention Week. Efforts to reduce exposure in our everyday environment, as well as surveillance to identify exposed populations, need to be on the agenda. They need to be prioritised. There are simple messages that we as an SEGH community can be getting out there. Looking at in our everyday environment, how can we reduce exposure, whether that's taping or covering over peeling paint, whether that's ensuring we don't burn contaminated wood and fuel in our fires, and certainly not putting that fire ash into our gardens. A real drive to not bring dust home from both your occupations, but from the garden. Thinking about how we limit the use of products from outside Europe for those of us in the UK, because some of the traditional medicines and sweets and spices are known to contain lead. So I'm going to draw this to a conclusion. So why lead? So hopefully we can all see that lead exposure, not only is it entirely preventable, but early intervention is absolutely critical. The impacts of lead, particularly on children, are largely irreversible, not totally irreversible, but largely irreversible. So early intervention and prevention is critical to stop long-term health effects. What's new? Well, we've launched the Eclipse programme, admittedly in one UK city at the moment in the UK. We want to see it unlocking a large-scale prevalence study in the UK, or even a national blood lead screening programme that can use some of these sampling in your home environment approach. And what can we all do about it? We need, as a community, to support lead awareness activities. Lead hasn't gone away, it's still in our everyday environment. The use of lead gasoline, I guess, is a classic example of our willingness to adopt a technology without really thinking through the broader environmental consequences. And we are at risk of repeating these mistakes over and over again, as we hear often at our annual SEGH conference. So our children's future, we must do better. And I think here is where our society, and particularly the SEGH community, are well placed to not only raise awareness, but to provide the evidence base of the links between environmental pollution and health. So thank you for listening. And I will obviously keep SEGH community updated with this new approach to biomonitoring that we're trialling in Leeds. So thank you for your